Life is so unpredictable. Our struggles are actually the same. We all want what's best for our families and what's best for our children.
The people that come to Community Nurse are our neighbors, the young adults in the community who are just starting out and don't have access to any health insurance or affordable health insurance. They are families who are struggling financially, and they are the people who work in our community and our businesses who don't have access to health care. Patients should not have to leave the place they live and work to get quality health care services.
When you have a person who maybe had a great job and for whatever reason with the stock market crash and all the things, the housing bubble breaking, and they end up in the same situation financially as someone who maybe has struggled their whole life.
Community Nurse focuses on providing integrated healthcare services for our patients, medical, dental, behavioral health, and the integrated is the important part of that. We make sure that our providers communicate with one another so that they are aware of all the challenges that our patients may face.
The prenatal woman who's coming in for her care brings her newborn. Those pediatric patients get their medical care here. They can see the dentist here. We have mental health care services here. They bring in their family.
When I'm able to give people their smiles back and then actually teach them how to keep them and then help them understand how it interacts with the rest of their body, it just makes for a holistic healthcare. I see my job as more than just fillings and extractions. I see, my role and what I've been created to do is just to enrich people's lives and make them better people overall.
Our focus is to make the patient feel that this really is their medical home. It's not just a current cliche that we like to tag onto our services, but to really make the patient feel this is the place where I know I can walk through the door with any medical, dental, behavioral health challenge I have, and they are going to help me.
Whether it's the homeless patient that I have who has not been taking his medications because he has no medical care, or it's that mom who has that 2-year-old with Down syndrome who is so excited to tell me that her 2-year-old is taking her first steps for the very first time or saying her first words. It's making a difference in those patients' lives. We're growing because we want to meet the needs of the community that we serve. We know that there are many patients who don't have health care in this area or have minimal health care, so we want to grow. We want to take care of these people that need our care.
I think what has sustained Community Nurse for 95 years, it's that we all have such a passion and commitment to a very strong mission, which is to make sure that everyone in our community can have access to quality healthcare services. We share that with other partners in the community, like LaGrange Hospital, the doctors who have helped us throughout the years to provide services to our patients, whether it's primary or specialty care, other healthcare partner organizations that have helped us to integrate healthcare services. Whether it's working with provider volunteers who have worked in our shops, our staff, funders in the community, the hospital, we show them that we provide very good outcomes in terms of the quality of care that we provide our patients, and also that we're really good stewards of the investments that they're making in Community Nurse.
The vision for what we can accomplish would be to reach as many people as possible.
Our goal is to make sure that we make our vision of being a healthy community a reality.